So I guess the way I usually explain it to my clients is terrain of the soil. So the soil that allowed the weed to grow in the first place, then how can we expect that the weeds aren't just going to...
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am joined again by the amazing and wonderful Emily Carhill. Emily, thank you for joining us. Let's start with that of just the pathophysiology of the disease and what kidney cancer actually looks like versus chronic kidney disease.
Sure. So kidney cancer has actually been on the rise, sort of similar to kidney disease. Sort of since the 1970s, the incidence of kidney cancer has been increasing, which may partly be because we are better at picking it up, but also because a lot of the risk factors are, sort of, I guess, lifestyle type things as well. So, I guess going back to what cancer is. So cancer's when cells in the body have become abnormal for some reason and they start to grow and multiply too quickly and sort of out of control. So our body doesn't have the same checks and balances that it usually would have to keep control of these cells. And they also don't act on their own. So cancer cells also enlist, our other body cells, genes and proteins and things like that in the body to help them to continue to grow and divide. So it's, I guess, a little bit similar to kidney disease. Symptoms or signs of symptoms of kidney cancer don't often come up until the cancer is sort of a little bit larger and a bit sort of further along because some of them are quite vague. And they're also actually quite similar, to signs and symptoms of kidney disease. So things like having blood in your urine, having pain on your back, sort of on one side. Sometimes people can get a sort of a bit of a mass or a lump on one side of their back, loss of weight, loss of appetite, fever. That one's obviously different from kidney disease, and anemia. So I'll often see that people are diagnosed with kidney cancer often actually when they're getting investigations into something completely different. So they've got something else going on and they've had a scan and it's been picked up then, rather than, having signs and symptoms and going in and sort of getting those investigated.
What diet and lifestyle advice and potentially supplementation and treatment would you be implementing for that person? And and how do you see that go? And do you see that people have long-term really great changes without, metastases and cancers coming back?
So I guess the way I usually explain it to my clients is who have cancer, that think of the body as a garden bed. And so, we've got this cancer, so we've got these weeds growing in the body. We can go in and we can cut them out. We can use, herbicides and pesticides and we can poison them and get rid of them. But if we're not actually changing the terrain of the soil, so the soil that allowed the weed to grow in the first place, then how can we expect that the weeds aren't just going to come back after we've gotten rid of them? And so that's sort of similar to the body. So, cancers develop for a range of different reasons. There's a range of different things going in the body to allow that to happen. And we need to, I guess, sort of identify what those could be and target them, change the terrain of the body so that we're less likely to have these weeds grow back. And I guess when I'm talking about the terrain of the body, obviously I'm talking about, diet and lifestyle and stress, but also particularly looking at some of the things that we know drive on cancer. So inflammation is a really big one. Oxidative stress is another one. Our immune system, so how well our immune system is functioning, because part of our immune system's role is to identify cancer cells in the body and get rid of them. And obviously, if that isn't happening, there's something going on there. And then also blood sugar regulation is a really important one. So we know that most cancers will preferentially use glucose for energy. And that's part of the reason why people with diabetes are at such higher risk of cancer. So we also want to sort of manage blood sugar as well. So I guess they're the kind of key areas that I'm always thinking about. If someone's going through active treatment, so they're having, whether it be immunotherapy or targeted therapy, I guess the most important thing that I want to say here is that to get qualified health advice from someone if you're going to be taking supplements. I think, there sometimes a bit of a belief that natural medicines, being natural, are inherently safe, but alongside certain medications, and particularly alongside chemotherapy or targeted therapy, they can actually interact. So just be really careful about where you're getting your information from if you're going to be taking supplements at the same time.
And run me through what type of dietary changes you would be making with someone, because it's obviously going to be, well, maybe it's not. I know I treat cancers very differently to kidney disease as far as the diet that I implement, because obviously I'm going for, exactly as you mentioned, blood sugar regulation being my, key priority. And I also often use ketogenic diets in cancers. Walk me through what you do with, say, a renal cell carcinoma and dietary changes.
Yeah. So with renal cell carcinoma, with all kidney cancers, actually, when they've sort of done studies, you sort of want to be looking more at a sort of, I guess, Mediterranean type diet, so low carbohydrate type diet. Not dissimilar, I wouldn't say, to a diet for someone with kidney disease, where you want, high levels of antioxidants, high levels of anti-inflammatory nutrients. But for kidney cancer, ketogenic diet actually makes outcomes worse. So that's probably the one. Yeah, when they've studied it over all of the different cancers, ketogenic diet isn't a good one for kidney cancer. So,
For the protein intake, same as normal kidney?
Yeah, I think so. It wasn't really clear exactly why. And I'm not sure if it's, again, for proper functioning of the kidney, we want an alkaline diet. So whether it's to do with that. So yeah, actually quite similar really to someone with kidney disease. So again, I'd be pulling out things like dairy, red meat, any of those really highly inflammatory sort of type foods. And yeah, focusing more on the sort of antioxidants, fruit and veggies, but again, monitoring blood sugar. So I often get people to, even if they're not diabetic, but they have cancer, to measure their blood sugar 1 or 2 hours after fasting and 1 or 2 hours after eating, for a couple of weeks, so we can sort of see, what sort of diet for them is going to be best for their blood sugar. Because again, there can be sort of, sometimes someone will strangely spike their blood sugar to something that you would never expect. So I generally will get them to do that so that we can sort of really become quite targeted with what they're eating and how that they can manage blood sugar regulation.
So thank you, Emily. I really appreciate your expertise in this area. And make sure you hit subscribe. If you want more information about who we are at Kidney Coach, head over to www.kidneycoach.com. So until next time, make sure you subscribe, give us a like if you like this information. And if there's any specific topics you want to know, make sure you add it in the comments below. All right, have a wonderful day, Emily. Thank you. And we'll talk to you next time. Bye.